All right, let's dive into a high-yield clinical primer on folliculitis. It's a really common challenge, whether you're in dermatology, primary care, or even the ER. This explainer is designed for practicing clinicians and anyone prepping for specialty exams, so let's get right to it.
And before we jump in, we want to give full credit and a huge thank you to Dr. Mohammed El-Nagi Mohammed. He provided the fantastic source material that this entire presentation is built on. So, at its core, what is folliculitis? It's just an inflammation of the hair follicle. But, that simple definition doesn't really capture how tricky it can be in the clinic. The real challenge is that the cause can be anything, an infection, a chemical, or even a physical injury. And that means it can show up as anything from a few mild bumps to a deep, painful infection that can actually lead to scarring.
Now, it's absolutely crucial to distinguish folliculitis from a furuncle, which you probably know as a boil. A furuncle is what happens when things progress. It's a much deeper infection that goes beyond the follicle itself and into the surrounding skin. Recognizing this difference is key because it changes your whole management plan, often meaning you'll need to do an incision and drainage.
Figuring out the cause is everything if you want to treat this effectively. So let's start by breaking down the #1 category of triggers, the infectious agents.
Okay, this table really helps organize our thinking here. When it comes to bacteria, Staphylococcus aureus is by far the most common bad guy. But, and this is a big one, if your patient mentions being in a hot tub recently, your brain should immediately flash to Pseudomonas aeruginosa, which causes what we call hot tub folliculitis. For your immunocompromised patients, you've got to think about fungal causes, like Candida. And finally, don't forget about viruses. Herpes simplex can cause herpetic folliculitis, which usually looks like a little group of blisters on a red base.
And here's where we make a really important pivot in our diagnosis. We've gone through the bugs, but what happens when the cultures come back negative and the patient isn't getting any better on antimicrobials? Well, that's when you have to start thinking about non-infectious causes.
So, that brings us right to our next major category, folliculitis that's caused not by a pathogen, but by some kind of external irritant. We can pretty much split these triggers into two big groups, chemical and physical.
And this slide right here shows why taking a really thorough patient history is so important. On the chemical side, you're asking questions like, are you using any strong steroid creams? Because that can cause steroid acne. Or do you work with any industrial oils or tars? Then on the physical side, the triggers are often just part of someone's daily life. We're talking about irritation from shaving, especially shaving the wrong way, or friction from tight clothes, or even just having a bandage on for too long. All these things can disrupt the follicle and cause inflammation with no infection needed.
Okay, so we've covered the why, now let's focus on the what. What are those classic signs and symptoms we should be looking for when we're actually examining the patient? The classic look is redness right around the hair follicle that can turn into little pustules. Patients will usually tell you it's itchy or a bit tender, and sometimes those lesions can even break open and form a crust. But as we're about to see, where these lesions are is just as important as what they look like.
And there is nowhere that this distinction is more important than in the bearded area of the face and neck. Seriously, we're talking about two conditions that can look super similar but have totally different causes, and because of that, totally different treatments. This is a really high-yield topic, both for exams and for your everyday practice.
Okay, here's the key difference you have to remember. Folliculitis barbae is a real infection, usually from Staph aureus. On the other hand, pseudofolliculitis barbae is not an infection. It's an irritation problem caused when shaved hairs curve back and poke into the skin, which creates a foreign body reaction. A huge clinical clue is that you see it way more often in men of African descent because of the natural curl of their hair follicles. Getting this right is so important. It's how you avoid giving unnecessary antibiotics and instead give the right advice about shaving.
And that really brings us to our final thought here. We've seen how a simple-looking pustule can be caused by a bacteria, a fungus, a virus, a chemical, or just simple friction. So the question to leave you with is this. Knowing the huge difference between an infection, like folliculitis barbae, and an irritation, like pseudofolliculitis barbae, how do you tailor your entire clinical approach, from diagnosis to treatment to patient education, to fit the specific cause? Because making that distinction, well, that's the essence of great clinical care.